I'm going to shift over to Maureen, who's going to give you an idea of some of the timelines and issues we're dealing with on a more systemic level.
Thanks, Suzanne. Okay, so we covered a lot, but you've got kind of the big components or big chunks of it. We've given you a couple of themes, of course, things you'll want to look at in terms of your own circumstances. We've identified many that will need some discussion with the state, and you'll want to be encouraging and helpful to the state as they begin to put their arguments together. So let's talk about how this is going to happen. Okay. So we do know that there is additional regulations coming. I'm going to mention a little bit more about that. But this rule is in effect as of March 17th of this year. So it's in effect now. The requirement of the rule is that every state must give a transition plan that addresses how they're going to deal with any of these kinds of circumstances where their programs do not completely align with what's specified here. And the way that requirement is framed, it is that the state must provide the feds with their transition plan as soon after March 17th of 2014, as soon as they submit the next waiver amendment. And it is not just the next DD amendment, it's whatever the state's next waiver is, all the waivers then have to be addressed, and the transition plan is intended to address a state's circumstances completely. So not the aging on one time frame and the DD on another. Now, Ohio had several waivers that were due after this date, and what they did wisely was to speed up the submission and get all of the waivers in before the deadline, so that where Ohio stands today is that the next waiver that is due is the assisted living waiver, which expires the end of June of next year. Okay, so what that means is that March 17 of 2015, March 17, Ohio has to have their plan submitted to the feds. So 1 year after the effective date, if not sooner, Ohio submits its plan. Now, the only caveat to that is, at this point, there is no waiver amendment that anyone is specifically aware of. But, for example, we know that in the MBR, there is a provider rate change in assisted living, for example. So if, in order to do that rate change, the state has to submit a change, then they will have to submit their transition plan for everything. Okay, so nothing is planned until next year, meaning our deadline is March 17, but if anything happens with any of the waivers in the meantime, then that could trigger the state having to submit the plan. And why I'm emphasizing that is, all these things we've mentioned about the state, the decisions they're going to have to make, the justification arguments they're going to have to present, that's all got to be done as part of this transition plan. Okay? So that transition plan becomes pretty important. States will be then asking for so many years in order to make all these changes. They can ask for up to 5 years, which frankly ends up being, we can see at the bottom there, May 17 of 2019 is the absolute drop dead. All the changes have to be made before then. The state will ask for 1 year, 2 year, 3 year, and the feds will then decide how much time to give them. And as we look at the circumstances today, we are not expecting that CMS is just going to give everybody 5 years. We are not expecting that. Okay, they've been very specific about they're going to want to give the least amount of time necessary, and they're not going to tolerate if a state then sits and waits until 2 weeks before the end of 5 years, for example, and then tries to do something. So they're really being pretty sticky about this. And why this is important is that we expect that once that transition, the final date has been reached, that's when we expect that there may be environments that are currently being funded that would then no longer be eligible for waiver funding. Okay? So that's kind of the time frame. Here is a list of some of the particular areas that we know CMS has indicated they will provide additional guidance, sub-regulatory guidance as they refer to it. And you can see conflict-free case management is up here. That one, ironically, has been identified as one of 3 priorities by the National Medicaid directors. They've indicated this is one of their top concerns to get additional guidance from CMS is what exactly does conflict-free case management mean and how will that be operationalized, as well as back to the point that Jim raised earlier, the right to refuse and components of the regs that can be useful to address it. So informed consent sorts of issues and a variety of other ones in there that they're going to provide additional guidance about. We know that these, in order to kind of put all these changes into motion, it's going to affect a number of key things, and just kind of at a high level, of course, we've mentioned, rules, regulations, potentially statute would have to be changed in order to align with what these requirements specify. As Suzanne and Gary both mentioned, licensure, certification, payment rules, compliance rules, all those things will have to be realigned. We'd also kind of frame it as who does what. Okay, so we're going to have to look at, like in the care planning, 2 slides of all these detailed things. So they're going to have to look at, okay, who exactly is supposed to be collecting or documenting this particular piece of information, and then making sure that that gets carried through in terms of rules, changes to forms, made more difficult by all the individualized approaches to care planning, but all that's going to have to get filtered on through the changes. Obviously, case management, service coordination are hugely important to this as it is to our system in total. And everything about the current waiver documents that the state currently operates under, that kind of massive waiver that is our contract, if you will, that it'll all have to be reflected in there as well. So then, what does this mean for you? Obviously, there's short and long-term implications. We, certainly Suzanne and Gary, opera, as well as individual ones of you, we're all working hard to get clarification on some of these things, continue to raise the issues and keep them in front of folks. We know that the state, for example, has a multi-agency work group that's meeting. And again, kind of keep in mind, this stuff isn't complicated enough just for our field, but add into it that the state's got to be addressing aging and medically complicated kid waivers and all of that all at the same time. So the departments are all now meeting together to sort out what all this is going to mean for Ohio. We would encourage you to be doing a self-evaluation, as hard-nosed and honest as you can, strict or hard on yourself as you can to see whether you're in compliance with all these different areas. Collective work or work cooperatively with OPRA is going to be important here. And again, can't stress enough that CMS has made it very clear they will be giving much deference to the states, and so we're going to want to make sure that the state is able to make forceful arguments on behalf of these things, so we don't end up with unneeded or overly burdensome responses to these different things. So right now in the MBR, there's a very spirited fight about some additional money for child welfare and adult protective services. And as you know, adult protective services is the same sort of support for elderly individuals who may not be able to make their own decisions. And Ohio provides really paltry sum to the counties to provide that support to Ohio's seniors. We do expect, and I'm hearing it already from that system, that they are expecting to see more and more seniors identified as needing adult protective services. Now, it's not our system, but frankly, I think, Scott, what we're going to see is a lot of pressure on this very issue of supporting people, whether they're seniors or with disabilities or children with, those kinds of additional complexities about decision making. We're going to see that pressure, I think, on all of our systems to be, and frankly, I mean, my own sort of observation is that we don't have a lot of discussion about that, frankly, in any of these human service areas, and so it's probably high time that we do that.